is Dr. Kuria. I'm a cardiologist working here at the Heart Care Clinic. We are based in St. Teresa Hospital here in Tindigua. Here at the Heart Care Clinic, we are able to diagnose all types of heart ailments. We take care of people who have hypertension, diabetes, heart failure, people who present with chest pain, swelling of the legs, feeling breathless. All those are symptoms that can be related to the heart, and we have the capability to be able to diagnose every single heart disease and also to be able to take care of it. We have the equipment where we are able to do what we call non-invasive testing of the heart, and we do those tests here in the office. We do the ECG, we do an echocardiogram, and we also do an exercise stress test, which is a very important test for trying to identify somebody's risk of getting a heart attack. So basically this hospital is well equipped. We have everything here. The laboratory is available, the medicines are available in the pharmacy, and so we're able to take care of you one stop option to be able to take good care of your heart. So at the Heart Care Clinic, we are able to diagnose various ailments. We have, when you first walk in, and we first take a history of whatever it is that you are ailing from. The history is very detailed, and we go even into the family history to try and establish what could be happening. Then the tests that we do that are specific to the heart, we have a test called an ECG or electrocardiogram, and with that test we are able to check the electrical activity of the heart. Once we check the electrical activity of the heart, we do another test called an echocardiogram, where we are able to check the actual structure of the heart. We see it beating, we look inside to see the size, we check the valves, we check if there's any water around the heart. We're even able to measure the pressure inside the lungs, because if any of these things are not at the proper limits, then it can cause problems of breathlessness, leg swelling, coughing, and just feeling generally tired. Then there's also a test called an exercise stress test. This is a test where you walk on a treadmill, and it goes in stages where it starts slow and then it gets faster and faster as it goes up an incline. And this is really just to test the exercise capacity of an individual, and more so we use it to check whether the blood vessels that supply the heart, those vessels are called the coronary arteries, whether they are patent enough, whether they are letting and allowing blood to pass in the proper fashion. So we are able to tell somebody's risk of suffering a heart attack. Other tests that we do for people who have high blood pressure, we are able to check their blood pressure on a 24-hour basis. So we have a 24-hour blood pressure monitoring equipment. So this equipment that you're given, you go home with it, and it measures your blood pressure overnight, even as you're sleeping. And then when you come, we're able to draw a graph and see how is your blood pressure behaving. This is an important equipment because it is able to tell us whether someone is truly hypertensive, or whether the high blood pressure that is being recorded in the office could be maybe due to anxiety or something else we call white coat hypertension. It's also a very good test for helping us to identify people who sometimes they come to the office, the pressure is always high, yet sometimes probably at home it is normal. So we use that test. Then there's also a test we call a 24-hour Holter. This is like an ECG, but we give it to you for 24 hours. So it measures your heart rate over 24 hours. It's a very important test to help us identify people who have abnormal heart rhythms. Because the heart is a dynamic organ, it is always changing. When you're walking, the beats are different, or rather the heart rate is different. When you're sleeping, the heart rate is different. And there are some people who experience palpitations, where they feel their heart is beating too fast, and when they come to the doctor, the heart is measured and it is normal. So that's when we have now the need to check it over a 24-hour basis to try and see whether there's any problem going on. If we identify certain heart problems, we are also able to do various invasive procedures. We're able to put pacemakers for people who require them. Those are the people who their heart is either beating too low or who have heart failure and have that indication. They have heart failure that is of the type that would benefit from special pacemakers. We are able to do that. We are able to open blocked vessels of the heart, what we call PCI or percutaneous coronary intervention. We are able to do many things, including even treat veins in the legs that may be blocked, the things that we call varicose veins. We are able to do all those. So like I said, this hospital, St. Teresa Hospital, once you come here to the heart care clinic, you're going to get all the services available, and most of the time everything will be available and you'll be able to have everything done in one sitting.